Winnunga Nimmityjah is Wiradjuri words for strong health.
Winnunga is the heart of our community.
I've been coming to Winnunga for 20 years. And now I have a family of my own, and I now continue to bring my children to come here.
Took all my kids to Winnunga when they were young. So, yeah. And when I knew it was an Aboriginal service, we were proud to just have our own services. That's how long ago I've been coming here, 31 years.
I've been going to Winnunga since 74, I think. I come down from Darwin after Cyclone Tracy, and I always come here because there was all the people I know come here.
Canberra is only an hour away from Cooma, so I travel up here to get all my health services done here in one spot.
People do tend to forget that here within Canberra we have a significant Aboriginal population. There's around about 7,000 Aboriginal people just in Canberra and many more within the region. And we also tend to forget, I think, that even though Canberra is prosperous, there are a lot of people here who do it really hard, and the issues that many in our Aboriginal community face are exactly the same as they are elsewhere in Australia.
It's got a huge benefit, not just for our community, but for the wider community. And, it's so good that so many people embrace us.
Every community should have a Winnunga, in my opinion.
When I started, I had 5 staff and a $241,000 budget. And now I've got 80 staff and a $12 million budget. So because Canberra, I guess, in the scheme of things, when you're looking at Aboriginal health nationally, I think that we tend to get overlooked. However, we've got a large Aboriginal community, not just in the ACT but right across the region. And our clients come from 334 suburbs, 223 postcodes, and I think there's around 66 postcodes in the ACT.
Well, it came to my notice firstly when a couple of activists from Winnunga came to my office looking for funds. And they made a very clear case for the health centre. It wasn't a hard decision to make, really, because the need was there and it was important to make the decision quickly.
So when I moved to Canberra, there were 2 reasons. I moved to Canberra as the head of the National Aboriginal Community Controlled Health Organisation, of which Winnunga is a member. So I have a really long-standing commitment to Aboriginal community control of primary health care. And secondly, and perhaps most personally, because I needed a clinic, a health service for me and my family, and Winnunga was it. There was nothing better, and there still is nothing better.
The inception at the 10 Embassy, there was a part-time clinic that ran out of the Shortcuts building that was behind the Griffin Centre. It was another building behind the Griffin Centre. And that happened on a Wednesday and a Saturday morning. So Dr. Pete used to drive down from Campbelltown and run those clinics.
Olive Brown and Kay Mundine, they were red hot when it came to this health centre, and they made a good case. I wasn't aware of the push for the health funding for the Aboriginal Health Centre up until that point, but there was no doubt about it that there was a need for it, and it was needed to be settled quickly, so that's what happened.
Olive was a trailblazer, and with so many young kids, and she was an amazing woman, and we could never forget that Olive was the founder of Winnunga, from humble beginnings, I say. Olive was really unwell, and she passed away in 1993, and she'd handpicked who she wanted on the board of Winnunga, and I was one of the people that she'd handpicked. So there were 6 of us. And Judy Harris, and Jude's passed away too, and she was the chairperson pretty much from day one. And so there was Judy, Glenda Humes, Bonnie Brown, who's passed away, Chris Jard, myself, and Robin Bancroft, I think, was the first board of Winnunga.
So I've been the chairperson of Winnunga for just over 3 years, 3.5 years, following the wonderful Judy Harris, who stepped down at that time.
Judy Harris, you know, Judy and I were really, really good friends, as well as she was the chairperson of Winnunga for a very long time. And she was an amazing woman. I remember in the early days, you know, when I first started at Winnunga in the role of CEO, I lived out at Banks, and Jude would be there every night, and we'd be, because we had a laptop computer and a bubble jet printer and a fax machine. So I was, you know, like CEO by day and then home of a night, because I had nowhere from the Griffin Centre. We only had 2 phone lines, one into Dr. Pete's room and one in the reception. So, you know, it wasn't like I could pick up the phone and talk to people as I needed to, because I used to have to wait, because, you know, if there was calls coming in and Dr. Pete was with a client, well, you know, can't just barge in and say I need to use the phone. So, and yeah, even though I had a mobile, you know, mobiles were fairly new back then. So, yeah, at home, we'd work until, you know, midnight, 2 or 3 o'clock in the morning, and that would be every night. So, most nights and weekends, Jude and I'd be doing Winnunga business from my family room at Banks.
Well, the old building that Winnunga first got was in the city, and it definitely was a Bronx. You know, if you didn't know where it was, you couldn't find it, because you had to walk up, right out, and it was just a little office out the back. It had 2 offices. One was a reception and the other was Dr. Pete. And it was a Bronx. You put 2-3 people in the reception area and it was full. We had all the chairs out the back on the little walkway where we all used to sit while we were waiting for the doctor.
Well, it was a place of colourful stories around the Griffin Centre. There were a lot of people that were struggling, that spent a lot of their time around the Griffin Centre, and with it some interesting sort of goings on around the place. There was some criminal activity, I expect.
And you look around and you can see needles and people shooting up. That's how bad it was. And but they give them that little office just to shut them up, I think.
It was to do with the area. There was stuff going on there that the police were interested in, nothing to do with Winnunga. It was just that part of town. That's the way it had grown.
Yeah, the people that was at the back of the Griffith Centre, where Winnunga's first home, was not Aboriginal people. They were homeless people and sort of druggies and all that type of stuff.
It grew, it outgrew the Griffin Centre quite quickly, and it was quite obvious that it wasn't a place, you know, a permanent home for the health centre.
You know, it was the old saying, blacks out the back, that was it. And you get out there and you see them bonging up and rubbish all over the place. And it was terrible. It was like a Bronx.
The service has been built around client need. So we've always been a client-centric service. Before we were even accredited or had any data, we knew that even in the back of the Griffin Centre and in Ainslie, we knew we had a high intravenous drug use using population here in the ACT. We also knew that we had a serious mental health or, issues.
With all the stuff that Julie and the rest of the board went through, it wasn't long before we had a lovely place up at Ainslie.
The move from the Griffin Centre to Ainslie, it was like paradise. Even though it was an old baby health clinic, the walls were paper thin, it was like a big old house.
So I have happy memories of our days in Ainslie. Of course, I didn't have to work there. But it was, and I think partly because it was a house, the building was a house with a yard and all of that, I think it created a really friendly, warm atmosphere.
We had a beautiful yard and lots of trees and, swing set for the kids, and so it was a really nice environment.
It was sick as you might have been when you were going to see the doctor. It was always a place you wanted to go. And so I do remember the squeaky floorboards. And I do remember sort of the odd arrangement of offices and very thin walls.
Back then there was no thing about confidentiality because we had paper thin walls and you could be having a consult with Dr. Pete. And even though Dr. Tisser was a very quiet man, you could hear what he was saying to his client on the other side of the wall. So, it was pretty amazing, but nobody ever complained about confidentiality issues.
And but it was such a warm and friendly place. So the waiting room was the old lounge room. We had community events in the yard. And so I have really happy memories as a client of going to the old service.
It was good to see them move up to Ainslie, and then of course they moved on from there over to Narrabundah, and it's gone like a house on fire, really.
Well, in the early days, I was pretty healthy, so it wasn't too bad. I used to go to just community things, and then whenever I was sick, I'd go in and see Dr. Pete. And any other program, I've always been supporting and going to Winnunga programs and stuff like that. And then later on, as I started getting older, I started getting pretty sick. And now I utilise all their programs, especially when I had my bypass in 2011. I was in intensive care for 7 days, and I was in hospital for about 12. And then when I got out of hospital, then the support I received from Winnunga, that's the reason I'm alive today.
And we've been pretty much doing transport for clients since Winnunga opened back in the old Griffin Centre.
Take it, ready, love? You want to hop in? You hop in that chair there, love. And little sis in this one here. That one, all right? Have this one down. It's all right, love.
We've got so many families that are isolated with no transport. They've got a number of children and they've got lots of social issues, but also people with some serious health issues. It's about making sure that we can get them in when we need to get them in to see the doctor or the psychologist or the psychiatrist or the social health team or whoever, because you can have the best service in the world, But if people can't get here, you know, it just doesn't make sense. Winnunga transitioned an association to an incorporation in November last year. And the reason for that was we had a name change in the process. And so it's now Winnunga Nimmityjah Aboriginal Health and Community Services. And that's because of the number of services that we provide, particularly around child protection, court support, the work that we do in the Alexander McConaughey Centre, all the programs that we run. It just made more sense because people see health service and straight away they think of doctors, nurses and Aboriginal health workers, whereas Winnunga is much bigger than that.
Ta-da. Bye. Thank you, Caitlin. No worries. Bye, guys. Bye. See ya. Bye. See you later.
Okay, Crystal, what I'm going to do is now I'm going to test your ears with this machine. And what this machine does, it draws a picture of the inside of your ear. Do you want to see that?
Sure.
There we go. See that mountain there? That means that your ears are nice and healthy. That's really good. Well done.
Got an audiologist, we've got dietitians, we've got an optometrist. You know, most of them services are sessional, but they are really, really important. They're a vital part of the holistic care that we provide here at Winnunga.
As part of the Healthy Weight program, we encourage people to also exercise, and Winnunga does a gym program which is 3 times a week where people can go to the gym. So today people went to the gym before coming to the healthy cooking group. And exercise is important because it gets us up and mobile, moving, it gets us out in the fresh air, it makes us feel better. It helps us use the energy of the food that we're actually eating. We also give people a chart where we like them to tick off each day whether or not they've done some exercise.
Do you have to be a certain age to exercise?
No, not at all. So exercise is good for us from, you know, the young kids, little toddlers running around, they just exercise naturally, to being, don't know, you've got young kids running around after them, mums and dads running around after their kids, grandparents, it doesn't matter. Exercise is beneficial for everyone, and the more active you stay throughout your life, the healthier you are. I just want to talk to you today about, as part of the Healthy Weight program and healthy eating, a lot of people find it difficult to work out how much food they should be eating. You know, so the types are important, but also our portion sizes are also really important. And so one of the tools we use here is something which we call my Healthy Tucker Plate. Okay, and so it's actually a really good way because it visually shows us how much veggies we should be having, how much meat or fish or eggs we have as well, and also how much things we have of things like rice and corn, potato, sweet potato, okay, because those portions are also really important.
So we'll take it out. And
I noticed today you had a really nice meal of sang choy bao, which was meat and vegetables, and you had it wrapped up in lettuce leaves.
wrap it up.
And so that gave a good mix of all of those types of foods that we've talked about here. We had a mix of vegetables that were all chopped up and mixed in with our meat sauce here. And we had a little bit of rice noodles mixed in there, so we had some good carbohydrates in that as well.
You know, you're coming to every session and you're improving your health outcomes every day.
I've noticed the improvement within myself.
The More Deadly Tucker cookbook that the Healthy Weight program has, Hayley, you have one of these, you use it?
Yes, I use sometimes, but most of the time it's more or less what's in the cupboard.
Yeah. Well, most of this, the best thing about this cooking book is that it's normally what we've got in the cupboard. And when it's all lean meats and healthy fats. And here down the bottom you can see that it feeds 6, because you know when we're having tea, the mob comes over and we've got a big family. So this book has been targeted to feed up to 8 to 10 people.
We had community nurses back in the day. Their names were Jane and Leone. They were non-Aboriginal women, and they used to do the needle and syringe program and do wound care for our clients out of the boot of their cars. So for us to have a vending machine and a needle and syringe program here, that was just a natural progression. And I know that a lot of services aren't there yet. But it's not about just giving needles to people. It's the public health issues that if people aren't using safe injecting equipment, you know, Hep C, HIV, all of those other blood-borne diseases. And so for us, it's always about the health of our mob and making sure that they're safe. I'm really excited that Winnunga's going to be providing services out at Alexander McConaughey Centre as of July this year. A lot of those men and women in there are already Winnunga clients. So we have quite a number now of men and women who are incarcerated, and it just makes sense to be able to provide good health services, not only on the outside, but on the inside. When they reopened Cooma Jail, the inmates from Goulburn that got relocated to Cooma actually wrote to New South Wales Corrections Health and asked for Winnunga to provide a service to them in Cooma. So we went to Cooma Jail for 4 years. So prison health isn't new to us.
Well, Winnunga's community health centre, and like all other Aboriginal people, we go to our own mob. And as soon as they're opened, I was there, right from the start.
You know, Winnunga's always had an open door policy when it comes to access to our GPs, because we don't discriminate. So between 18 and 20% of our clients are non-Aboriginal people. Some of them are non-Aboriginal people that are partners of Aboriginal people. Others are the elderly here in Narrabundah, but also there's other vulnerable people in the community that prefer to access the Winnunga doctors.
Aboriginal medical services are much more than clinical factories. They are in many places, and Canberra is a classic example, where the Aboriginal Medical Service, Winnunga, is the largest and I think probably the longest surviving Aboriginal organisation in the city. And we, because of a holistic model of healthcare, because we think that it's not just about whether you're physically well or, but we're a whole person, right? That means that organisations like Winnunga are community hubs. They certainly deliver high quality healthcare, but do so much more in terms of support for people, in for example, housing, or people that are in custody, people that are having really difficult times in their life that go beyond just the clinical need.
The support and everything that I get from Winnunga and Julie, especially Julie. We lived in the caravan park over in Southside, and because of my health and everything, we couldn't live there anymore. So again, I went and spoke with Julie, and Julie did us up a lovely letter to give to the Housing Commission, and she spoke to the Housing Commission as well. And now we live in a beautiful, brand new, fully disability home, 2-bedroom, and it's beautiful. After living in a caravan for about 17, 18 years and come to something like this is beautiful. And I don't think we would have got there without the help with Julie and Winnunga.
It is a real community hub. In many communities, they were the very first organised representation of the principle of self-determination. So after we moved out of the assimilation and protectionist sort of eras into the era of self-determination, it was medical services, Aboriginal medical services, that led the charge.
So once again, I want to welcome you all here to my beautiful country, Ngambri Ngunnawal. Thank you.
We have a long way to go towards reaching equality. I am glad to see so many of you here today to show your support, standing together to remember the wrongs of the past. Acknowledging and ongoing struggles of today, being committed to live in a city where no individual family or community gets left behind. I thank all the Winnunga staff for their unwavering commitment to the community and for making events such as today's Surrey Bridge Walk happen. Your work does not go unnoticed. And finally, I'd like to acknowledge and thank Julie Tongs, the CEO of Winnunga, for consistently over the last 19 years leading and ensuring Winnunga remains a truly caring and well-managed organisation. Thank you, everyone. Have a great day.
And welcome, everybody. Firstly, I'd like to say a big thank you to Louise, Tina and Adrian for their welcome to country and the smoking ceremony. I'd also like to acknowledge all the Aboriginal brothers and sisters and our non-Aboriginal brothers and sisters here today. The Sorry Day Bridge Walk was a Winnunga initiative back in, I think, 2009 when the Bringing Them Home report was released. Winnunga staff, it was my Beth Sturgis and Ian Bateman, thought that, you know, it'd be really good for Winnunga to actually march to acknowledge and recognise those people from the stolen generation.
Can I ask that the schools that did banners, if they could come up to the front now?
There's been so much support from a number of schools, and we have a banner so that, you know, the best banner wins a painting or an artwork done by a local Aboriginal artist. It's such a good day. That event now has gone from strength to strength. And back then I think there was about 10 people that attended that. And over the years it's just got bigger and bigger and bigger. Last year was amazing. In November we did the activation for the Deadly Choices, who was partnering with the Rugby World Cup team. And we were very, very fortunate to have Mal Meninga, Dane Gagai and Cooper Cronk here at Winnunga. And Steve Renoff, who was a Queensland football player for a very long time and an absolute gem of a person. So the kids loved it. People, you know, asking them to sign their Deadly Choices shirts. But the Deadly Choices was also about signing up for health checks. And we had an explosion in health. We've always done well with health checks, but we had an absolute explosion because to be able to get a Deadly Choices shirt, you had to have a health check. We've done 43 health checks. We've got 11 today, and they're still booking. And we had 3. And we had 3 new clients last night that didn't know about, they hadn't heard about Winnunga before. So it's an honour and a privilege to be standing here with such rugby royalty. And rugby, NRL, sorry. You know, you see the shirts walking around all over the place, you know, people say, oh, well, I see people down at the shops and they got their Deadly Choices shirts on, and, you know, that was really, really good, a great initiative, and that was in partnership with the Urban Institute of Health in Queensland.
Yeah, I've been to Nimmityjah, been there with did the video with Nimmityjah. The diabetic clinic is a big thing. It's not just for the diabetic, it's there as a community. You know, we all go there and we sit down and have a beautiful day. You know, they put on a beautiful lunch and it's just everything. And all other programs that Winnunga run, I virtually attend because I'm more retired now. Look forward to going to some of their programs or all of their programs.
We have family days here at Winnunga to showcase our services, and we have kids' Christmas parties. And it's really important for us to do those things, and particularly for the little kids, because we know that they're going to look back over the years and they'll say, you know, we were at Winnunga party, and because they've always got good memories of that.
One of our students, Michaela, was very excited to share that the most special day of her year is the Winnunga Christmas party each year. So we're really fortunate that we're 450 metres from Winnunga and that we get to celebrate every year the Christmas party with the community.
Parents struggle to put food on the table, let alone buy their kids presents at Christmas. So if that's something where we can take pressure off families and know that the kids are going to have a good time, and the parents, then that's really, really important.
The relationship and association between Winnunga and Narrabundah Early Childhood School has been a long-standing one that began when we had Narrabundah Primary School here. And I came to the school in 2012, and at that stage some strong connections and partnerships had been established and were being strengthened. Our connections also with Winnunga are involved with the paediatric nurse comes down to visit. We have the people come down to test our Koori preschool children's hearing every year, and we have people come down to work with us in an art capacity and to work with our children to support them with their relationships and their understanding of their culture and who they are, and for everyone to have that understanding.
Hi, my name's Dion DeVere. I'm the president of the Winnunga Warriors Basketball Club. In 2015, we established the club as a result of seeing a need in the community to do something for our Aboriginal and Torres Strait Islander children with respect to healthy lifestyles and sport. So I approached Winnunga Nimmityjah and talked to Auntie Julie Tongs about the possibility of her becoming involved with the club, supporting the club through an auspicing type arrangement. And we started off with 4 teams, 2 under 12s boys teams and 2 under 12s girls teams, and in the past 3 years the club has grown. Sometimes we have 10 teams in the comp, but we have boys and girls teams in under 10s, 12s, under 14s, 16s, and the senior competitions as well.
It's cool. Thanks now. Just come along.
So without Winnunga Nimmityjah's support, the support of the organisation and Auntie Julie Tongs, we probably would never have got the club up and running, and we're really proud to be a part of the Winnunga family and affiliated with the Aboriginal Medical Service here in Canberra, the ACT. I'm really honoured to have the support of Julie Tongs, Auntie Julie Tongs, the CEO of the organisation, and the organisation as a whole. And we've now been established and running for 4 years, and really proud of the fact that we have nearly 10 teams with Aboriginal and Torres Strait Islander children and non-Indigenous children as well, and families.
Winnunga support Winnunga boxing. We couldn't do without them, put it that way. Like, if we've got boxing tournaments in Sydney or country somewhere, they give us a bus to take the boys, which is very, very important to us. And they do a lot of things like we go to a big tournament, one of the biggest in Australia, the Golden Gloves. They help pay for the boys to get there, and they do all the coordination to the flights and everything like that, and then the boys pay them back in a little way. So yeah, in every other prospect, and plus all the doctors there help very much. We have to have combat sport want serology tests by all boxers. So Winnunga actually we organise through Michael, our manager, who works Winnunga, and he organises the boys there to go and have their serology tests and their boxing tests. So yeah, Winnunga pay the rent to the government for this building, and which, you know, you just couldn't do without it. That's why, like, it's just a pure boxing gym and fitness. Adrian, our assistant coach, he does all the fitness side. We have up to 20 to 30 people just come for fitness. Probably have about 16 boxers at the moment. So the club is pretty successful, actually. It's been done well. We've had a couple of Australian champions over the years, and there's been a couple of programs which have been run through here, which is next door, which was like trades program, and the boxing was part of that program that was brought through. This one has been going for a long time, like up to nearly 13 to 15 years now. The fees are cheap. It helps a lot for the boys to come because a lot of people can't afford big fees. The people of Winnunga are fantastic, like Julie, CEO. I've known her since I started, and she's been absolutely fantastic. Very supportive in every possible way you can. If it wasn't for them, I don't think the club would be here, put it that way.
Winnunga also has an elders garden in Queanbeyan, and Uncle Brian Demery's been looking after that garden for a very long time.
About depression, that's the worst thing a man can get just about. Well, my wife passed away, and I just locked myself in the house. I went that depressed, wouldn't open the door to no one. And the minister here come down and he said, "Oh, I've got a job down here, will you help me down here?" So he gave me the garden, and I haven't looked back since. Well, sitting at home's no good. You get down here and you don't think of nothing. All you think about is the garden. What's got to go in? What's got to come out? Well, you name it and I grow it. Stuff that's only grows in cold climate. The pumpkins just make it, the butternut pumpkins, lettuce, carrots, chilies, cucumbers, 3 different types of cucumbers. Well, it makes you feel good because they're just like your babies. You've planted them as a seed, some won't grow, and then you've got to nurse them, and you've got to put them in, put them there, and then you get them up, and then you put them into the garden, you know, and then you pick them. So it's good, it's very satisfaction. I've been chasing funding for a long time. I've done it for about 3 years out of my own pocket. Then the council gave me $500 for 1 year, and then Julie, I went and seen Julie about it, and Winnunga took over.
He's a very special man in our community. He's done an amazing job with that garden in Queanbeyan.
They've been great help. They give me anything, you know. So yeah, they've been wonderful, Winnunga. I wouldn't be able to operate without them.
I just think, you know, all the Aboriginal staff here do an amazing job, and we're very fortunate too to have a lot of good non-Aboriginal staff from different cultural backgrounds.
Canberra is a better than average income town, and it's it's somewhat of an embarrassment that we're not able to provide services to everybody, but Winnunga feels a gap which might not be filled by the General Health Service, and that's why it's so important to see it grow. And I'm sure it will, because I know the people associated with it are working hard and they want to see it grow, and they want it, but not just because they want to see it grow, they want to see it provide more service to the community, and that's a great thing.
It's been a long time coming, but it's coming, and the ACT government committed in the last election to a $12 million building for Winnunga, a new build, and I just think that that's amazing. I never ever thought I would see that, and hopefully I will. Hopefully I'll stay around long enough to see it. If all's fair and equal, you know, like I'll, in the next probably 3 years, we should see a new building pop out of the ground here somewhere.
So we've got a beautiful health centre here in Canberra, and all them people out there should definitely, that runs health centres, come down to Winnunga and have a look at what programs they run, and get out there in the bush and run some of these programs, because I go to the bush, you know, condo, everywhere, and they haven't got these programs. They haven't got what we got here in Canberra. So they should come here and take a leaf out of what we got here, and through the hard work that Julie has done over the years.
Our clients deserve the best, and I just think that for us to be able to do that and to involve them as we're building, and to make them part of it, and not make it a big sterile building where people don't feel comfortable, but to make it a workable, functional building for our clients and staff, because that's what they deserve.
The future I see for Winnunga is a really bright one. I think we're in a really good place as an organisation. We've got a solid 30-year history of deep commitment to the Canberra and region Aboriginal and Torres Strait Islander communities. I'm looking forward to a new facility. I'm looking forward to living up to the challenge that we set ourselves when we changed the name of the organisation from Winnunga Nimmityjah Health Service to Health and Community Services. I think that's a really important statement, that we're not going to be boxed into just a little area of clinical service provision, but that we already do so much more than that. And having that recognised in our name, but also having that recognised by significant stakeholders around town, such as governments and funders, is a really important thing. I see us in the future as, well, I already think we're the best Aboriginal health service in the country, but as a real role model for other organisations that maybe are just starting out. And so there's a real opportunity for us to be able to provide support to fledgling organisations and other organisations that are wanting to grow and wanting to really make their mark.
If you go back to the 1989 National Aboriginal Health Strategy, in the back of that report, you know, it documents everything about each state and territory and what they were actually doing in the Aboriginal community controlled health space. And there was a paragraph in there saying that Winnunga was mainstream. So we've come a long way, and I'm really proud of that. But I'm proud of, you know, all the people that have worked at Winnunga, and each and every one have made a difference to the lives of the people that access the service. So that makes me feel proud.
Well, she's done fine work for 21 years, you know, and that's, she can take a lot of the credit, with all of the other team that she has working with her, for all that's been achieved by Winnunga. So, and Julie's always been somebody that you knew meant business when she was talking Winnunga. And she was always a pleasure to deal with. And she's always got good results, and I hope she continues to get better results.
The future of Winnunga, I think, is so exciting. And I think we're a permanent part of the landscape here in the ACT and the region.
The only way that things are going to change is that if we have Aboriginal health in Aboriginal hands.
I went out to the old reserve to see if anyone's cooking damper. I went out to the old reserve to see if anyone's chanting song. I do it myself, but it's not the same thing as watching the old folks on the old reserve. I went out to the old reserve to see if the elders were telling stories late at night by the campfire, mythical legends they could yarn. We'd all gather round on our old tribal ground, men, women and children on the old reserve. I went out to the old reserve to see if anyone's hunting kangaroo. I went out to the old reserve to listen to the plaintive drone of a didgeridoo. When I opened my eyes, there was no one around, but I could hear the sound of the old reserve. I could hear the sound of the old reserve.